Hi, everybody. It's Dr. Carey, and I have another mini lecture for you today on HIV. Um, you know what? I find HIV really fascinating because of the way the virus structure works and how it uses its own cells to replicate itself. In the same way, it's kind of scary because it does that, right? So you need to think about how we can um, use these types of systems to understand viruses and how viruses replicate themselves. It also helps us understand how we can create vaccinations that can help interrupt that cycle, or other ways that we might do that, which they're doing with the COVID-19 um, virus right now, right? So hopefully we'll see some big changes with that COVID-19 information in the coming uh, months and years. But first, we want to take a look at the HIV cells. And so when we get a virus that's been introduced to the body, we end up with this cell. It's called HIV. And it is a type of an antigen, and it comes and it fuses with a CD4 cell receptor. That makes sense. That's how most antigens come and become connected to our CD4 receptors in some way. Once it is connected to the CD4 receptor, it undergoes a process called reverse transcriptase, and that changes the RNA of the virus into DNA so that it acts like the cell. The CD4 cell DNA with HIV DNA particles produces all these particles, which then become part of new HIV cells, which are spread throughout the body. So as CD4 cells are replicating themselves, they're adding this HIV antigen to them, and they've already got it built into the new DNA. So we know there's lots of modes of HIV transmission. Today it is better understood how HIV is transmitted, and there's more preventative measures that are available for different individuals. It's still difficult for many people, and there's still some individuals who are high risk for HIV transmission. So it's still important to be aware of. You want to know that high risk individuals are those who take part in unsafe sex practices and don't use protection. What I mean by protection is latex condoms for the men. Men who have sex with men should also wear latex condoms. Latex condoms have a tendency to break more frequently in those instances. So that can be an issue as well. And then IV drug abusers are also at high risk. Big things that have helped with both of these are condoms availability at different locations and clean needle availability. Acute HIV infection is a flu-like syndrome. It lasts it starts about 2 weeks after you actually get the virus. People don't usually seek health care because it's the flu. It seems like it isn't a big deal, so people get respiratory problems. They'll have a cough, a fever, a runny nose, and it goes away. And it doesn't seem like a really big deal. And so they don't connect the two. They don't think this could be HIV. They don't connect the fact that they had sex with someone 2 weeks ago to this respiratory problem. The HIV RNA levels are one way that we can measure the viral load. It tells us how many viral particles are present in the blood, and it also lets us know at the very earliest, it gives us some HIV infection indication. So we can do some RNA level testing pretty early on to test for HIV infection. When we do this, let's say we do this with somebody who's knows they have had sex with someone that was a high risk person and they're worried. We can start doing those tests immediately, and then they'll do them about 2 weeks after the event, and then about 6 weeks after the event, and then a couple more times perhaps. You can also go to a lot of clinics and have these done for free. So it's important to know that the access is there. People may not always be able to get to the doctor or know that they can ask for those free tests. The HIV antibodies actually form after quite a long time. It can take 2 weeks to 6 months. So that's why they do the testing over several months in order to make sure that we're catching it, because it can happen at so many different time points. There are two main tests we use today for HIV antibody detection. One's called the ELISA test and one is called the Western blot test. That window period, which is the time from when they contracted HIV to when antibodies are developed, the patient is seronegative during this time, and so our ELISA tests are going to be negative. The HIV antibody tests will be negative, right? Because our patient hasn't converted during this time. But once they've converted, then we'll get a positive test. So we'll see that seroconversion will happen once our patient who had a negative test has moved to a positive test. And like I mentioned on previous slides, anywhere from 2 weeks to 6 months. And we also see that we have a change in our blood levels. So as our HIV at 2 to 6 weeks were here, as those HIV blood levels, virus load levels, begin to rise, our CD4 counts are going to begin to drop. And so we'll end up with a very low number of CD4 cells, and this corresponds with the severity of the illness. As our viral load goes up, our CD4 cells go down, and eventually our patient will move from an HIV diagnosis to an AIDS diagnosis. To have a diagnosis of AIDS, our patient has to drop below 200 counts for our CD4 cells. Our CD4 cells have to be lower than 200. The latent period is known as the time when the virus particles increase in the blood. The CD4 levels are decreasing, and this is a time when we have an increased vulnerability to opportunistic infections. So opportunistic infections is actually a wide term and can happen to anybody, not just HIV patients. But it happens when someone is immunocompromised and they get an infection that's different than the reason why they're immunocompromised. So anytime someone who has, let's say someone has cancer and they develop a yeast infection, that is an opportunistic infection because the cancer patient's blood cell levels are so low that they become ill with something else. That happens with HIV as well. And opportunistic infections can be pretty complicated and can make it difficult for a high quality of life for our patients. These types of infections can be things from cancers. The most common one, and you should remember that Kaposi sarcoma and HIV run together most frequently. Pneumonia, tuberculosis, sexually transmitted diseases, and other bacterial infections. Also yeast and fungal infections could also fit in there. HIV basically makes it easier for the person to become infected, and they could also die from other causes, even though HIV is probably the original cause. The symptoms that our patients would have if they have an opportunistic infection anything from breathing problems and fever to weight loss, skin rashes, diarrhea. AIDS diagnosis happens once the CD4 cell count level drops below 200, and AIDS stands for Acquired Immune Deficiency Syndrome. The HIV antibody has his levels are quite high, and our CD4 levels are extremely low. Our patient must have all three of these things. They have to have a CD4 level of 200 or lower. They have to have the presence of HIV antibodies, and they have to have the presence of an opportunistic infection. There are many successful treatments and actually some preventative treatments today. So HIV infection can be a chronic infection today. We treat with multiple agents that impact HIV at different points in the life cycle to keep it from impacting our CD4 counts. We usually use more than one drug to do this, and there are multiple types of drugs, and some of them are combination drugs. The types of drugs which you don't really need to know at this point, but just so that you've heard them before: fusion inhibitors, CCR5 receptor antagonists, reverse transcriptor inhibitors, protease inhibitors. And then there's preventative treatment called PrEP. It's HIV pre-exposure prophylaxis, or PrEP. And then this is an antiviral medication that can be used in highly susceptible or high risk patients who are not currently infected. It basically involves taking one pill that's a combination of a couple of the two pills, and it's called Truvada. You've probably seen a commercial for PrEP and Truvada on TV, if you've watched TV lately. Then I want to have you watch this video. It's going to show you a visual of how the reverse transcriptase actually works. If you can't hear the video words, you can use this link and copy and paste it into your web browser.
The first enzyme, HIV reverse transcriptase, copies the viral RNA genome by combining individual host nucleotides to build a complementary DNA strand. When reverse transcriptase finishes this strand, it will replace the original viral RNA with another DNA strand, forming a DNA double helix. Two types of drugs block reverse transcriptase. Drugs like AZT mimic the normal building blocks of DNA, but prematurely terminate the DNA chain. Drugs like nevirapine bind on the backside of reverse transcriptase, distorting the enzyme so that it can no longer perform its DNA building reaction.
All right, so that's the end of this presentation, and we will talk to you later on, okay? Thank you.